Hello Hires, today we are going to look at Unit 2, Key Area 3, the control of reproduction. We're going to specifically look at subsection C, which looks at contraception. So our learning outcomes are to explore the physical and chemical methods for contraception. You'll be successful if you can give examples of both physical and chemical methods, understand the biological basis, as it's termed, of the physical methods, understand how the contraceptive chemical management can be done, and understand things like progesterone only and emergency contraception. So contraception, when we talk about contraception, we are just talking about the intentional prevention of contraception or pregnancy by natural or artificial means. There are certain parts of the contraception topic that the higher human course avoids. We avoid abstinence only contraception education, as there are a variety of flaws in abstinence only education, not just the fact that people incorrectly assume that if there is no penis and vaginal sex that you can't get pregnant. So we mainly concentrate on the physical and chemical methods. The physical methods listed here are barrier methods. So you need to understand how it is that these barrier methods prevent pregnancy. And they do it by physically preventing the sperm from reaching the ova. So you have intrauterine devices, you have barrier methods such as the condoms, diaphragm, cervical caps, and you can have sterilization procedures. The intrauterine device, the slides are slightly misleading in that there's some intrauterine devices that are a purely physical mechanism, and there are some that release hormones. So we mainly look at the physical ones here, like the copper coil. So this is left in the uterus and it prevents implantation and in general prevents the sperm from getting into the uterus a lot of the time. So you can see here we have the intrauterine device sitting quite high up. Quite often it ends up with the T-bar sticking down here, and you can see the strings here. These strings, it's a bit like an umbrella. You push the T-bar up with the wings down, and then when you pull the strings, they open up. The strings, when the intrauterine device goes in, are actually quite long, and then they are snipped with a pair of scissors internally after it's put in by someone with very careful hands. When the intrauterine device needs to come back out again, the strings allow a nurse practitioner or doctor to fold the bars back down and remove the IUD. Sometimes the IUD can get stuck, and then a more surgical method would be required to remove it. Interesting, an IUD is something that can be put in after a successful C-section. So you can have a baby taken out, and while you are open, a IUD can be put in at that point. It's easier because it doesn't require an uncomfortable appointment at the doctor's, and it can go in from the top rather than in from the bottom. So, avoidance of the fertile period is a method of contraception, but we do not talk about that. So the IUD is placed in the uterus. It's a copper coil and it has these threads. It prevents implantation of the embryo, so the slides insist that it is a contragestic device rather than a contraception. Ironically, the person who made these slides is the principal assessor of higher human biology. So if he really cared that much, he would have changed the wording and the need to knows. So how it works. It stimulates the presence of the white blood cells. It's actually a medical miracle that fertilization ever occurs. The uterus and vagina are a very hostile environment for sperm, and the IUD increases that hostility. It stops the mobility of sperm, irritates the lining of the uterus, making it so that even if fertilization does occur, it doesn't implant. Unfortunately, it can cause things like bleeding, it can cause inflammation, and because the fertilized embryo, the zygote, can implant in the uterus, it sometimes finds somewhere else to implant. So you can get a pregnancy that's ectopic. These are quite dangerous, so you don't really want to have an ectopic pregnancy. Quite often, because of the fact that it impairs the mobility and irritates lining and things like this, quite often you advise not to have sex around about the week before or after getting your IUD. Many people have ethical apprehension about IUDs because the fertilized embryo has been made and you're just providing a hostile environment to it. So quite often we'll see it as a form of termination or abortion because you're just preventing a potential life from implanting. Sterilization procedures, so you can have vasectomies, you can have tubal ligations. Vasectomy, vas deferens, is the scientific name for the sperm tube. So you cut or tie the sperm tubes. This prevents the sperm being released because they try and leave the testes and there is nowhere for them to go. The sperm produced then would be undergoing phagocytosis, so they don't just sit there for the rest of your life, they get digested. Tubal ligation is the female form, so it involves cutting or tying the oviducts. This prevents, again, the egg getting near the sperm, and as we know, the oviduct is the site of fertilization, so if the sperm and the egg can't meet, can't have fertilization. This is a large picture of the male anatomy, and you can see the tubal ligation of the vas deferens or sperm tube, and you can see tubal ligation in the female as well. Lovely. More tubal ligation, and you can see more tubal ligation. Chemical methods. So we looked at the physical methods, the barrier method, and the tubal ligations. The chemical form is basically using what we know about the menstrual cycle in the same way that the previous topic that looked at how you can help someone get pregnant used our knowledge of the menstrual cycle. This uses that against your body. So the oral contraceptive pill, or the OCP, usually contains synthetic estrogen with synthetic progesterone. So this has both. The pill is taken every day for 3 weeks from the final day of the previous menstrual period, so from the bleeding finishing. This increases the concentration of estrogen and progesterone, and we know that will exert a negative feedback control. So when we were doing IVF, we put artificial LH and FSH in because that got past negative feedback. This causes negative feedback. That's how it works. Secretion of FSH and LH are inhibited. Follicle maturation is therefore inhibited, and you cannot ovulate. So no mature follicles and no ovulation. A placebo pill could be taken during week 4. It just keeps you in the hang of taking a pill every day, and that allows your estrogen and progesterone levels to decrease. As a result, you would still be able to go through the menstrual period, which I'm not quite sure is the point. Quite often people find that with heavy periods, taking the OCP helps quite a lot. Some people find it makes it worse. The morning after pill, so this is technically a form of contraception, it contains a very high dose of the hormones in the oral contraceptive pill, the OCP, so your estrogen and progesterone. So you're really, really doubling down on not being able to allow ovulation. They're taken after unprotected sex to prevent ovulation or implantation. You need to take them usually within 72 hours because if you think about it, if you're at exactly the right point of your cycle when you have your unprotected sex or your risky sex, then you could be unlucky and you could get a form of implantation really, really quickly if the sperm and the egg meet almost immediately. So really, the sooner you take it, the more effective it is. Mini pills, so remembering the OCP, the oral contraceptive pill, was estrogen and progesterone. The mini pill is only progesterone, so they don't contain that synthetic estrogen. They thicken the cervical mucus and reduce the viability of sperm. So we talked in a previous video about the fact that the mucus in the cervix between vagina and uterus is really thick. The sperm cannot penetrate that mucus. So if you keep it even thicker than that all the time and, properly ramp up the progesterone, the sperm can't get there. This form of contraception can also be given as the implant, so the subdermal implant you can get in your arm. This is a form of like the mini pill, basically. And usually you would have to have the implant replaced every 3 years or so. So the advantages of the mini pill are it can be used during breastfeeding, can reduce cramps and heavy bleeding, can be taken by women who cannot take estrogen, and can be taken by women who have high blood pressure. As always, this video does not count as an appointment with a qualified sexual health or family planning nurse, because some people can't take the OCP due to family histories of things like bleeding disorders and strokes. So obviously, if you were thinking of getting one of these, you would want to make an appointment with a doctor or nurse. Disadvantages: you have to be taken at the same time every day, can cause breast tenderness, mood swings, weight gain, and irregular menstruation. So comparative efficacy, things like the implants, the IUDs, physically cutting through things like the vas deferens and the fallopian tubes, they are fairly effective, but either due to people not using them properly or just unfortunate coincidences, and hormones are tricky things. So you can get some errors. You've got injectables, so you can be injected with some hormones, and that can form a part of contraception. There's the pills, so your OCP pill and your mini pill. There's LAM, so to some extent breastfeeding, especially if you breastfeed along with co-sleeping of some safe form, that gives some measure of contraception. Male and female condoms, most of the lack of efficacy of these things, except for the fact that that one has a massive hole in the bottom. That's my thought on that one. Most of the issues with these are user error. There's ways to use condoms, both the male and female form, that are very effective. Similarly, the diaphragm, not having a well-fitted one or not using it with spermicides. Fertility awareness, so if you have sex at an infertile point of your cycle, the rhythm method, it can give you a contraceptive effect. Withdrawal, what a lovely picture. It's not particularly useful, and spermicides on their own, not a particularly brilliant idea. Okay, you can have a go at these questions. The use of cervical cap is a barrier or cyclical method of contraception. The morning after pill is physical or chemical. An intrauterine device prevents implantation of an embryo in the oviduct or endometrium. Mini pill contains synthetic estrogen or progesterone. Sterilization of women involves tubal ligation or a vasectomy. Now use textbook or what I've just told you to try and work that out. Okay, the answers to those questions are the use of a cervical cap is a barrier method because it's physically stopping sperm and the egg meeting. The morning after pills, chemical means. So that's high doses of the OCP chemicals. Intrauterine device prevents implantation in the endometrium. Mini pill contains synthetic progesterone. And sterilization is tubal ligation in women and a vasectomy in men. So you should know the contraceptive types, physical and chemical, and the biological basis of physical and how the chemical ones affect the female cycle. The biological basis and the physical chemical methods. There was talk of a male contraceptive pill, but partly there's a lack of trust that people would actually take that pill, or that you could trust someone who said they were taking that pill, or that people would remember to take the pill. Women have the benefit of being the one who will actually become pregnant if they don't take the pill. So men might forget. And also, men in the trials reported that because the male contraceptive pill, if you remember the first key area, uses testosterone's negative feedback loop, they reported that high dose testosterone made them very aggressive, and they didn't feel that was a very good idea. So because it was not palatable to men and not palatable to women, a lot of the research was discontinued. But there is a fairly recent, more palatable male contraceptive pill that's come out. So hopefully that progresses. Okay, if there's anything you need to know, please do ask in the assignment.